Hello everyone, welcome back to my channel. In this session, it is actually a continuation of the spinal cord. So till now we have seen the external features of the spinal cord. We have seen the internal features of spinal cord under the heading the grey matter of spinal cord, and this is about the white matter of spinal cord. So those who haven't seen all these sessions, please have a quick look before you see this session. So let's move on to the white matter of spinal cord. So what do you mean by white matter? White matter means they are the bundle of nerve fibers. So in brain, when we talk about grey matter, it is the nuclei of neurons, whereas white matter means the nerve fibers. So we will come to the spinal cord. When we discussed about the grey matter of spinal cord, we have seen that the grey matter is somewhat arranged in the form of an H, and the white matter fibers will be arranged around the grey matter. That means the white matter is outside and the grey matter is inside. Now the white matter mainly consists of myelinated nerve fibers. That is the reason why it gives somewhat white color. That is the reason why we call it as white matter. Now let's discuss first the type of nerve fibers arranged around the grey matter. So what are the main types of nerve fibers you get around the spinal cord? So you have sensory nerve fibers, you have the motor nerve fibers, and you have the association nerve fibers. Sensory nerve fibers means they carry the sensory information from different parts of the body towards the higher centers of the brain. What do you mean by motor nerve fibers? Motor nerve fibers are the fibers which control the movements of the body, which controls the muscles of the body, and they start from the higher centers of the brain and they terminate in the periphery, mainly in the anterior horn cells of the spinal cord. And what do you mean by association nerve fibers? So these are the three types of nerve fibers you get. You have the sensory nerve fibers, you have the motor nerve fibers, and you have the association nerve fibers. So the association nerve fibers are the fibers confined to the spinal cord. They won't go away from the spinal cord. They will be actually seen within the spinal cord, and they will be actually connecting the different spinal segments. So once again, how the sensory nerve fibers enter into the spinal cord. We know that if you just consider the spinal cord, this is the dorsal horn and this is the ventral horn, right? So the fibers will be actually entering into the dorsal horn, and that you call it as sensory, and the fibers will be leaving from the ventral horn, that you call it as motor, and these two will together form the spinal nerve, isn't it? So the sensory neurons will be actually the central process. You have the pseudounipolar neurons and the dorsal root ganglia. It has got a peripheral process and it has got a central process. So it is through the central process the sensory neurons enter into the spinal cord. And you have the ventral root of the spinal nerve through which the motor part is leaving the spinal cord. So when we talk about the nerve fibers within the spinal cord, we can roughly, though we functionally say it as sensory, motor and association fibers, there are mainly 5 types of fibers. One is these fibers which enter into the spinal cord in the form of central process of pseudounipolar neurons. Then you have the long ascending fibers which reaches into the higher centers. So that is group 2. Then you have long descending fibers which reach to the anterior horn cells. You have the anterior horn cells of the spinal cord here, and so the descending fibers will be terminating in the anterior horn, so that is group 3. Then you have the interneurons, the fibers which connect these neurons, that is group 4, and finally the nerve fibers which leave the spinal cord from the ventral horn, that is group 5. So these are the different types of nerve fibers which you see in the spinal cord, and according to its function we can just group it as sensory neurons, motor neurons and association neurons. So all these fibers will make up the white matter of spinal cord. Now the white matter region of the spinal cord is divided into 3 columns. One is the posterior, one is the lateral, and the other one is the anterior. So anterior column, lateral column and posterior column. So how is this division based on? So the anterior column extends from the anterior median fissure. This is the anterior median fissure up to the ventral horn. So this region is known as the anterior column of spinal cord. The peculiarity of this anterior column of spinal cord is this anterior column on one side will be communicating with the anterior column on the other side through the anterior commissure. Okay, so this is the commissure which connects the two anterior columns. Now the next one is lateral column. What do you mean by lateral column of the spinal cord? That is the region of the spinal cord lying between the two horns. So this region from the anterior horn to the posterior horn, this is known as the lateral column of the spinal cord. And finally you have the posterior column of the spinal cord. Posterior column extends between the posterior-median septum till the posterior horn of the spinal cord. So this region is known as the posterior column. So on either side of the posterior-median septum you have the posterior column. So the important thing which you have to remember at this point is the anterior columns are connected through anterior commissure, but the posterior columns are not connected because there is no connection between the posterior columns. But here in the anterior column you can see that they are connected between. Now when we mentioned about the type of nerve fibers, we mentioned about sensory, motor and association fibers, right? So let's have a look at the arrangement of the sensory, motor and association fibers within the white matter. So when we talk about the lateral column, this is the lateral column. In this region we usually get both motor and sensory nerve fibers. You get the sensory nerve fibers as well as motor nerve fibers running through the lateral column. What about the anterior column? This is the anterior column, right? So anterior column is mainly made up of motor nerve fibers. When we mentioned about the grey matter, the ventral horn is actually motor and the dorsal horn is sensory. Likewise, the anterior column is mainly motor. And the posterior column again is only sensory. That is an important thing you have to remember. Whereas the lateral column contains both sensory and motor. Anterior column also contains some of the sensory fibers, but it is mainly motor. The lateral column is mixed. It is having more or less equal number of both sensory and motor fibers, and the posterior column is chiefly sensory. That is how you get the nerve fibers arranged in the white matter of spinal cord. Now we know that there are many types of nerve fibers in the spinal cord, and it is not easy to remember each and every nerve fiber running through the spinal cord, because it will be hectic task to study each and every one. So mostly we will be discussing the important tracts which you need to know. So at this point I would like to define what do you mean by a nerve tract. So nerve tract means it is made up of bundle of nerve fibers which originate from one common point. It will be having a common course and it will be terminating at one single point. So all those nerve fibers which have got a common origin, which have got a common course and which have got a common point of termination, you call it as a nerve tract. And sometimes the nerve tract is also called lemniscus, especially in the brain stem, and you will also come across another term known as fasciculi. So all these are bundles of nerve fibers which are having a common origin, which have got a common course and which have got a common point of termination. So when we talk about the nomenclature of the spinal nerves, it's very easy. That is, when the first half of the nomenclature will be the point of origin and the second half will be the point of termination. So when we discuss about the nomenclature, we can mainly consider the nerve fibers as descending tracts as well as ascending tracts. Okay, so descending tracts means they descend from higher centers to the spinal cord, whereas ascending tracts means they ascend from the spinal cord to the higher centers. So these are the two important tracts you will come across in the spinal cord. So which are the higher centers above the spinal cord? You have the brainstem in the form of midbrain, pons and medulla, and above that you have the cerebral cortex. So let's see how you are going to name the tracts according to its origin and termination. So descending tracts means the origin will be from higher up centers and it will be terminating in the spinal cord. So let's see, if it is arising from the cerebral cortex and if it is ending in the spinal cord, the first half will be the point of origin. What do you call that then? It is known as corticospinal. Okay, corticospinal. The next set of fibers, they are arising from the midbrain, especially from the tectum, and they are terminating in the spinal cord. So the first half will be the point of origin, that is tecto, and the point of termination is spinal, that is tectospinal. The third set of fibers, again descending fibers, they are arising again from the midbrain, that is from the red nucleus. Red, usually we call it as rubro. So if it is arising from the red nucleus and terminating in the spinal cord, you call it as rubrospinal. So these are some of the terminologies which you will be coming across when we discuss about the descending tracts. So corticospinal, tectospinal, rubrospinal. And one important thing you have to know is the descending fibers are mainly motor fibers. And corticospinal, since they are passing through the pyramid of medulla, they are also known as pyramidal tract fibers, and all the rest of the motor nerve fibers are usually known as extrapyramidal fibers. So motor fibers, you can just classify it as pyramidal tract fibers, which are the fibers passing through the pyramid of medulla, and all the rest of the fibers which are belonging to the motor tract, you call it as extrapyramidal fibers. Now we will try to name the ascending fibers. So the ascending fibers start from the spinal cord and terminate in the higher centers, right? So the first one is, they are starting from the spinal cord and they are ending in the thalamus. So you call it as spinothalamic tract. It is very easy to name all these nerve fibers. Once you know the pattern of naming, it will be easy for you. Then the next set of fibers arise from the spinal cord, ends in the tectum of midbrain. You call it as spinotectal. Okay, spinotectal. The third set of fibers which I have shown here, they arise from the spinal cord, they end in the cerebellar cortex. Some of the fibers are actually reaching the midbrain and through the superior cerebellar peduncle entering into the cerebellum, whereas some of the fibers are reaching up to the medulla and they are entering into the cerebellar cortex. So both these fibers arise from the spinal cord and end in the cerebellum. So you call it as spinocerebellar fibers. Spinocerebellar fibers. So the details of the tracts we will be seeing in the coming sessions. So this is the simple way to name the fibers. So if you know the naming of the fibers, just by looking at the term, you can classify it as whether it belongs to the ascending set of fibers or whether it belongs to the descending set of fibers. Now let's see how these nerve fibers are arranged within the white matter of spinal cord. So let's see the anterior column of spinal cord first. So the anterior column, we have already mentioned it as mainly motor tracts. It is mainly made up of motor tracts. So what are the motor tracts which you are going to see? You can see so these are the descending fibers and these are the ascending fibers. So motor fibers means they are the descending fibers and ascending fibers are mainly sensory. So anterior column is mainly made up of motor fibers. That doesn't mean that it is not having any sensory fibers. It is having sensory fibers but chiefly made up of motor fibers. Posterior column mainly sensory and lateral you have more or less equal volume of motor as well as sensory. Okay, so first we will see the anterior column. We will see the descending set of fibers. Descending means coming from above and they are mainly motor. So let's see. So I've just put a code for this. Road of Vatican to church. Road of Vatican to church. So this R means medial reticulospinal tract. Reticulospinal means it is arising from the reticular formation of the brainstem and it is ending in the spinal cord. Then O stands for olivospinal, V stands for vestibulospinal, and T stands for tectospinal, and this C stands for the anterior corticospinal tract. So all these are the motor fibers which are running through the anterior column. Okay, road of Vatican to church. Medial reticulospinal, olivospinal, vestibulospinal, tectospinal, and medial most you have the anterior corticospinal tract. So you have to know that there are two sets of corticospinal tract, anterior as well as lateral corticospinal tract, out of which the anterior corticospinal tract comes in the anterior column. Now let's see what are the sensory components coming in the anterior column. We have the anterior spinothalamic. Sensory means they are ascending fibers. So they start from the spinal cord and they reach the higher centers. So anterior spinothalamic tract, and you have also the spino-olivary tract. There are many number of tracts apart from these, but these are the important ones you have to remember. So when we talk about anterior spinothalamic tract, just like the corticospinal, you have the lateral spinothalamic tract as well. Okay. So this is about the motor and sensory fibers arranged in the anterior column. Now let's move on to the lateral column. Lateral column, we already mentioned it as mixed type because it is containing the motor as well as sensory fibers almost in equal proportion. So let's see the descending fibers, that is motor fibers. The chief set of motor fibers are corticospinal tract. They are the important fibers which you should never forget, that is lateral corticospinal fibers. Then you have the fibers coming from the red nucleus, rubrospinal fibers, and this is again coming from the reticular formation. This is lateral reticulospinal. Okay, these are the chief motor tracts you should know when you talk about the lateral column. While we are more concerned about the different arrangement of these nerve fibers, you have to know this arrangement because whenever we talk about the spinal cord lesion, spinal cord damage, you have to assess which all fibers are there and which are the functions lost. Okay, so in order to assess the clinical condition, you have to know the arrangement of nerve fibers. So that is the reason why we are mentioning the arrangement of nerve fibers within the white matter. So this is the lateral column. So you have the motor fibers in the form of lateral corticospinal, you have the rubrospinal, and you have the lateral reticulospinal. Again, you will be having the sensory column, isn't it? They are the ascending fibers. So which are the sensory column you have? Sensory fibers will be starting from the spinal cord and they will be ending in the higher centers. So the sensory fibers are mainly ending in the thalamus as well as cerebellum. We have seen it here, the thalamus and cerebellum. So let's name it. This is the lateral spinothalamic tract. It starts from the spinal cord and ends in the thalamus. Then you have two bundle of fibers. This is anterior and this is posterior. Both are running to the cerebellum. You call it as anterior spinocerebellar and posterior spinocerebellar. So these are the sensory fibers you have. Lateral spinothalamic tract and anterior and posterior spinocerebellar tracts. Now coming to the posterior column. Posterior column is very easy because it is mainly made up of sensory fibers, and this is known as posterior column itself, and it is mainly made up of two sets of fibers. One is fasciculus gracilis. G stands for gracilis, and the next set which is lying lateral to it, it is known as fasciculus cuneatus. Okay, tract of Gall and tract of Burdak, if you want to know the name of the tract, but if you know this name, it is well and good. Fasciculus gracilis medially and fasciculus cuneatus laterally. So they are the set of ascending fibers which you get in the posterior column. You are not getting any descending fibers in the posterior column. That is a peculiarity here, and they are not connected to each other, whereas the anterior column, you have the fibers connected through the anterior commissure. Just to wind up about the arrangement of fibers, we have mentioned about the type of nerve fibers which you get, the sensory, motor and association fibers. Then you know how to divide the white matter of spinal cord into anterior column, lateral column and posterior column. Then you know how to name the set of fibers based on the origin and termination. Then you know how the different types of fibers, the ascending fibers and descending fibers, are arranged in each division of the white matter. In the next session, we will be seeing about the important descending fibers, the important ascending fibers and the blood supply and applied aspect. So keep watching. Thank you.